Coming up on the Get Lean, Eat Clean podcast.
We get it stuck in our head that the strengthening we need to do is very remedial and very static, right? So a lot of times people are doing bird dogs and side planks and curl ups and these very geriatric type movements or anti-movements, if you will, right? Limiting the amount of movement at the lumbar spine, which I think is the furthest thing from sport specific, especially when it comes to golf, because golf is it's static overcome by dynamic. So you kind of have this moment of stiffness when you make contact with the ball that is preceded by a ton of aggressive rotation. And that's where you're going to need your core muscles to be, the most active. You're never trying to keep you're basically using your rib cage and your pelvis as a slingshot and moving one away from the other and creating a lot of eccentric potential as you wind up your backswing, and then moving through a lot of concentric acceleration as you move through your follow through.
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed former professional powerlifter, chiropractor, and performance coach, Dr. Jordan Shallow. We discussed how he started his online biomechanics and resistance training course, Prescript. We also talked about how to avoid injury at the gym, the importance of assessing clients, how golfers should train, Dr. Shallow's training and eating routine, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Shallow. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin, and I have Dr. Jordan Shallow on. Welcome to the show.
Thanks for having me, man. Excited to be here.
Yeah, excited to have you on. I've been taking your course, watching your content, and now we get to chat about all things fitness and conditioning and strength. So
yeah, it's nice to be on. It's nice to have the other people unmuted. Well, I just usually sit there and talk into a void. So it's nice to actually have conversation because I human interaction escapes me sometimes because I just talk at my computer all the time.
Yeah, I can imagine. You started Prescript, right? When did you start Prescript?
Well, late 2015, 2016. I was fresh out of chiropractic college, living in the San Francisco Bay Area. One of my former classmates graduated together, friends, colleagues, training partners. Yeah, Jordan and I. I think late 2015, we kind of came up with this idea, and here we are, almost 10 years later.
Wow, amazing! And I'm loving it. I'm going through Prescript 1, and I would recommend it for anybody. I don't think you even necessarily have to be a trainer or health coach or whatever, because I think a lot of the stuff can just be used fundamentally in your own training. I've learned a lot of stuff, and I've been in health and wellness and fitness for a while now, but I've learned a lot of different things that I've never heard before. And we're going to discuss some of that today. But before we get into that, why don't maybe just give the viewers, if they haven't heard of you, maybe just a little bit of your backstory. I know some of it, but they might not.
Yeah, sure. Geez, how far back do you want to go? I'll pick it up in the professional career. I did my undergraduate at the University of Toronto. I went to chiropractic college in the San Francisco Bay Area. I graduated in 2015. I went straight to work in the corporate sector. I was a chiropractor at Apple's world headquarters in Cupertino, California. I took on a job as a strength and conditioning coach for the men's and women's rugby team at Stanford University at the same time. I held both positions for a number of years while opening 2 practices in the Bay Area, one in Mountain View, California, one in Dublin, California in the East Bay. And then coming out of the other side of that, I was also a competitive powerlifter at the time and started Prescript and started our own podcast. So it was a busy handful of years for me after graduating. And after a handful of years, I found myself getting propositioned to teach seminars and courses, usually on the backs of my powerlifting career, a lot to do with the information and content I was putting out on social media. I would travel pretty much all over the world to compete. And whenever I would get invited, they would be like, "Oh, do you want to host a seminar while you're here?" Hadn't really thought of it. was just a guy putting stuff up on the internet, trying to, to treat some patients in his practices. And then that sort of became like a thing. And I started doing more and more seminars as I competed, to the point where working and teaching kind of overtook my bandwidth to really train and compete at a high level. And ended up getting a job with in the corporate gym sector, in the big box gym, a franchise here in Canada called Good Life Fitness, and another internationally called Ultimate Performance. So they sort of hired me to develop curriculum and implement and teach it to their staff across the world. So I just did that. I packed up a duffel bag and a backpack and left California for what I thought was going to be 3 months, to just kind of teach consecutive weekends in a different place. And that ended up being the better part of 3.5 years, all the while kind of developing the online side of Prescript. At the time, all of the education I was doing was strictly, not exclusively, but strictly for these two major gym franchises. And I would fly from Halifax, Nova Scotia to Shanghai to Dubai to Burnaby, British Columbia, and pretty much everywhere in between. So they created like a little bit of an interest. I don't want to say a vacuum per se, but people were like, what are you doing? Like, why? What are you talking about? Why are you going all these places to talk to these trainers? And so I didn't have any exclusive agreements with either of them. And I just kind of woke up one morning and thought, I've got enough inquiries about this where I should probably do something about this. Because at the time, our business was primarily in training and rehabilitation. So we sold training products exclusive to barbell and strength athletes that, were dealing with nagging injuries, knee pain, back pain, things of the sort. But then we decided to shift the primary core of the business to education, get in where you fit in. And we released the Prescript Level 1 course 2017-ish, maybe the first semester. And, the company's grown expansively since then. And now we have level 1, level 2, and probably about 9 or 10 other courses spanning into the nutrition space, exercise programming. But the core track is really biomechanics and applied biomechanics and functional anatomy. And I just been developing that alongside my two business partners, Jordan and Matt. And we have a great team that's worldwide of guys that teach alongside us, develop courses for us. You mentioned Brandon Schultz, Killian Hamilton, Kyle Baxter, Stu Locke. It's like my parents naming their kids. Like I'm going to forget one, so I'm going to stop now. The ironic part is they only have two, and they can't remember both of them. So that's kind of brought up to speed of where I am now. Now I do a lot in so being a chiropractor still, I do a lot in the concierge space. So I work one-on-one with athletes, usually on the training and treatment side. So everything from living with them, going on the road, to seeing them periodically in and out of season. The majority of my clientele is NFL athletes primarily, a couple in Major League Baseball, a couple in the NHL. And when I'm not training and treating, I'm teaching and traveling. So it's kind of me. That's in a nutshell, as it were.
And you're also a dog lover, right? Do you have?
Yes. Oh my God, yes.
Okay. Yes. So I have 2 dogs of my own. You have a German Shepherd, is that right?
So he's living in the south coast of Australia.
Okay.
He's almost 11 now.
Oh wow.
Yeah.
Okay.
So I had him from eight weeks to about 5 years, and then he's overseas now, living the best life possible. German Shepherds they're a special breed.
Yeah. And did getting your chiropractic degree help you when you got into powerlifting after that? Is that correct? And competed, right? Or
that ran about a similar timeline.
Okay.
I had a friend of mine in school who was a competitive powerlifter from Wisconsin. I was always into lifting weights. I worked out in the off season to play hockey, and then I really kind of got bit by the bug while playing, to the point where I liked training more than I liked playing. And so I was decently strong at barbell lifts before getting into even the notion of powerlifting. But I would have done I think I did my first meet the summer after I graduated. So either the summer before or the summer after, 2015 or 2016. And then did chiropractic help? Yeah, I think to a large degree it did. I mean, it just gives you so much background in pain management, and really just the fundamentals of anatomy to be like, because everything hurts when you power lift, especially at like a competitive level. So I kind of it helped me really parse out the difference between pain and discomfort, and allowed me to push probably further than I would have been able to otherwise. Because I'm like, no, like I know this is fine. This is not, this is, my back is sore. It's not a disc injury like some people might jump to believe in. And maybe I would have as well without the horrible training that I had. So yeah, in a lot of ways, I think it was and still is super useful, despite of some people's thoughts on the education and the career path. But for me, it was the reason I went to school was to learn things to apply, to get bigger, to get stronger. And so I definitely put what I learned to work, and I thought it was super helpful in expediting my progress as a competitor.
Yeah, and let's actually go down the road of like injury. I feel like as we get older, like I'm 40 plus, you want to get strong, but you also want to avoid injury, because then you could be out of the gym for weeks, even more maybe, depending on the injury. What would you say? I know you guys, your definition of injuries, applied force is greater than tissue tolerance. So what are the best ways for individuals? I know this might be a broad question, but to sort of prevent injury in the gym?
Yeah, I think it's, controlling what you can control from a variable perspective on both sides of that equation, right? The applied force is, having an idea of what you're lifting. I think a lot of people don't have an established training program, and even the worst training program is better than no training program. So understanding, it'd be no different than, trying to lose body weight without having a really good idea of your macronutrient intake, your calorie intake, right? Training is very similar to that, where just having an understanding of your overall volume and intensity on a daily and summative weekly basis, I think is a great place to start. But then you can get a little bit more into the weeds as far as sleep quality, quantity, right? How do we improve that? Do we improve that with supplementation? Do we improve that with our environment? Do we improve that with our habits? Nutrition, right? Are we in some chronic pro-inflammatory state based off the amount of food we're eating or the types of food we're eating, right? Pain and injury, albeit not the same thing. They're both relatively complex as they're multifactorial. So, whether it's, like I said, like changing habits, changing nutrition, changing body composition, there's a lot that you can do both in and outside the gym. But I think the big rocks is just understanding your variables and understanding them as constants. And there's a lot of different things that you can begin to control, which will decrease the likelihood of injury. I mean, I think at best we're shooting for injury risk management, not necessarily injury prevention per se. But I think, there's a lot that can be done that is well within the control of someone who doesn't have a master's or PhD or is a pro athlete. I think it's just making conscious decisions, getting blood work done on a regular basis. All of these things, they might seem a little bit distant to the problem we're trying to solve of like, how do I avoid a muscle strain or a pull or a tear? But it's all one, the circle in the middle of that Venn diagram, it has a lot of overlapping factors. So really it's, as most people would just, what people might just deem as like living a healthier lifestyle, that will move the needle very rapidly in the direction of decreasing likelihood of injury. So, big ones for me, just to recap, probably, getting blood work. That's crucial. If you are in some sort of metabolic distress or compensation, what that can do at the level of the tissue as far as robustness versus fragility is as important as technique, as it's important in exercise programming, all of those things. So outside of the obvious ones, I think that's one that a lot of people gloss over that is very, very consistently an underlying marker. If you want to get big into the biometric side of things, if you have a way of consistently tracking HRV, now this is something that might be outside of the realm of possibility for most like work-a-day people, but in the athletic setting, we see that variable when solved for a pretty consistent mile marker of predicting injury. So,
Hmm.
there are a couple of things that, when you know how to interpret them properly, can really help you decrease the likelihood of injury short and long term.
And what about assessment? Just sort of knowing where you're at, like some of the assessments that you guys talk about in Prescript, like the 90-90 test. It's tough on a podcast to explain sometimes.
Right.
That they can't
Right.
like, but there's also like the Thomas test, right? Showing like how much hip extension someone has or lack of thereof, right? Like shoulder assessments. I find that like doing even just, I think if individuals do just a some type of like intro protocol to like shoulder intervention or like rotator cuff work even before they get into their lifts, I find that could be a way to sort of help prevent injury.
Yeah, I mean, movement quality is paramount, right? And I think from an assessment standpoint, there are things that we would attribute to potentially decreasing, like, can you get your arm over your head, right? Can you get your hip into extension? These are all things that at the binary level of ones and zeros, like at the source movement code, can be fairly complex, but there are ways to sort of weave them into normal exercise or what looks like normal exercise progressions and kind of meet people where they're at. So like loading outside of what we would consider an active range in what we would consider an externally unstable environment. So, you can make concessions of, hey, I can't get my arm all the way over my head or my shoulder starts to pinch. Like, do you get that same pinching if you do it on a cable machine shoulder press, or is it just with dumbbells? Oh, it's just with dumbbells. Okay. Let's do the overhead press on a machine. Maybe it's a cable pin loaded, maybe it's a plate loaded, maybe it's a Smith machine. And the external environment will allow us to get in a position where you can still push some meaningful weight, but don't succumb to the reactive stability forces that are required of your humeral joint, your scapulothoracic joint, et cetera. And then maybe we work on that in isolation somewhere else in your workout, right? So a lot of it is really on the job assessment. And I think the thing with assessment that can sometimes get lost, especially as we start to reach, not beyond the trainer and start reaching the end user, someone who might hire a trainer or someone who might just be an enthusiast themselves, is you're always assessing, right? So a lot of times we kind of put on our assessment hat, we walk in and we go, okay, whatever protocol people like to follow. And then they take that hat off and they go, all right, we're gonna just do like pretty much the same exercises I was gonna do anyways, but now we just know that like the left internal rotation is right or less than the right or whatever the presentation is. So, which look, I think is not necessarily a bad idea, and I think biomechanically we are far more similar individual to individual than like biochemically, and I think that's one of the reasons I'm drawn to this profession is like the amount of variability in expression of someone's biochemistry from person to person can be so variant. But from an anthropometry's perspective, like how much our skeletons differ, how much our muscular insertions differ, how much our tensile strength of baseline tissues differ, it's not anywhere near, like hematology presentation. So like what someone's blood chemistry looks like or something like that. So, it's not necessarily misguided to have a relatively general heuristic for assessment and training. I just think it's a little bit misguided to only adhere to those guidelines and principles during some arbitrary assessment period. I think that we should always be applying these base level principles to the actual stuff we're going to do with people anyways.
And a lot of these are just my own questions, but um, like when you talk about training and doing splits, and you talk about it before, like your pecs and your lats both internally rotate your shoulders, right? And I have some postural dysfunction, and I've always had it. And like I just wonder, how do you navigate training and also making sure that like you're not posturally getting worse as you go through your process?
Yeah, I mean, I don't pay much mind to posture. Um, I think there's no such thing as bad posture, only static posture is bad posture. So like it's not it's not the position you're not moving in that's the issue. It's the issue that you're not moving. Right. So that's kind of where, and as far as that impacts like lifting and mechanics and asymmetries and compensations, I think this is where like having a deeper understanding of, the ones and zeros really help, because I don't think compensations are there's more cells in our body that are autonomically mediated than voluntarily mediated, which means like most of our body's actions are happening without our say so. And like, thank God, because like most of us aren't, and myself included, like aren't smart enough to, I don't know, figure out how to turn this camera on, the two monitors that are in front of me, and turn this mic on, and also have to worry about all the other processes that my body just handles for me. So I think if you're a coach or you're an avid sort of weightlifting enthusiast, when you get into the realm of like compensations and we start talking about posture, and someone has rolled shoulders and wing scapula and tight hips and upper cross and all these things, it's just kind of like, to me, it's just all sort of red flags. It's, we're going to try and put them in the best position they can. Subjectively and objectively, we're going to get some feedback. Does it look good? Does it feel good? And when it starts to look asymmetrical or weird, it's like, I think we need to understand that humans are naturally robust and they are not inherently fragile. And there's actually a pretty large margin for error for what most people deem as good technique. Now, the real magic is understanding when and how and what muscles are going to be loaded during particular compensation. Then adjusting your program to train muscles maybe that will more directly train a muscle that is compensated away from in a particular movement, given a postural bias, or avoid training a muscle that works more in a movement because of a compensation pattern within other movement. So that's where load management really takes flight in a program. Is I can watch 10 people deadlift 10 different ways, and the rest of their programs might differ because of the way they go through that movement. Some might be sumo deadlifters, and they're more quad and upper back dominant, which allows me a little bit more of a window to load into a hinge position, because albeit a deadlift, not a ton of shear force on the lumbar spine given a particular structure. Now, someone might be doing a conventional deadlift. That's like a ton of hinge motion, which means like the chest is more parallel to the floor. And I'm like, well, that's a lot of shear force on the low back. That's a little bit more use in the lat. So I either, I'm going to shy away from more hinging, and maybe I have that person do a front squat rather than a low bar squat. So, as we deal with posture, I think a lot of times it can be somewhat of a red herring. I think, we have to accept that, life is asymmetrical, that there's really in the gym, there's lifting posture. That's all we're concerned with. And there are going to be interferences and impacts and compensations, but it's our brain doing what it does best, which is solving problems. And we just need to be one step ahead of that problem solving curve and start to predict based off the way our brain is, or a client's brain is solving this problem of a particular exercise, how we better put them in better exercises to solve for the remainder of that equation. Like, what's left? What do we need to train? What do we need to attempt to balance out? So it's a good question, because it's something that I think a lot of people, they just take a surface level glance at it and they go, oh, okay, yeah, that makes sense. Bad posture. I'm going to train more my upper back and rhomboids, because no, that's not really how it works. And I don't think it really matters. And a lot of people's rhomboid upper back issues would really just start to resolve themselves of symptoms if they were just generally stronger. And I think that's really where the sophistication comes in, is there's a simplicity to fixing a lot of problems. That's like, yeah, just do the thing where you can lift the most amount of weight given your current situation, and watch your situation drastically improve.
Well, I'm a golfer, so like I'm
Bless.
You're shaking your head. I'm always interested in learning about like T-spine mobility, right? I think it's important. I think a lot of golfers get injured. They're sitting in a cart. They stand up to go hit they haven't warmed up. They haven't done anything before the round. But these are just things that I do for myself. But T-spine mobility, and then like obviously being able to stabilize the lumbar spine, I think are two important things when it comes to rotation. What other things do you think people can do maybe as golfers that could help either prevent injury or help them become maybe more mobile?
Yeah, that's a great question. I shake my head because golf is so unbelievably complex, and they are probably, if you think about athletes, like I think athletes are sensory motor savants. Like when I see a really good athlete, I think of like Rain Man, but just with movement. And when I think of that, I think a handful of golfers really, really fit that bill. Like I've heard a story about Fred Couples put someone used to put loops of tape under his grip and then put the grip on and hand it to him and ask him how many revolutions of tape were under his grip.
Yeah, the wraps when they wrap their
Yeah.
grips. Yeah.
And he could tell you, and we're talking, I don't know, eighth of an inch, half a centimeter difference, and he could tell you without fail every single time. So now, golf, and an interesting task, and I like it because it's not, it's maybe not as expressive of like what some people might consider more primal or natural movements, like obviously sprinting, maybe a little bit technically upgraded normal gait cycle, you could refer to it as, or throwing javelin. These are all fairly fluid motions that can be replicated and that we're kind of built for. But golf is just a milieu of different. I don't know what the guy was thinking who put this together. But so I think hip mobility is massively underrated. So your ability to move the pelvis through the frontal plane, because a lot of times when we think hip and shoulder mobility, we just think of like the distal appendage. Like if I think shoulder mobility, I just think of my arm moving around. But it's like your arm moves in something that also needs to move, right? Your arm moves inside your shoulder blade. And there's a lot that goes into what moves your shoulder blade around. So when you look at hip mobility, you can look at it from either like a closed or an open chain. And it's not just internal rotation, which is often the case when we're lifting weights. It's like we want to improve internal rotation because internal rotation allows us to produce force. You want to have good variability of movement, right? You want to be choosing your technique, not being forced into your technique by a lack of access to a particular range. So frontal plane movement of the pelvis is big, being able to move your pelvis side to side. But if you want to have your knees and low back in a good, in good standing long term, you're going to need the femur to be able to rotate within that hip socket as the hip socket moves around the femur head. But a lot of times people think of like rotation either at the hip or shoulder, and they think about like, exercises like external rotation. It's like, well, I'm just moving my arm around. But in the case of sport, and especially golf, the analogy would be if my hand was fixed, I'm just grabbing the microphone here, and then I had to move my body around. It's like if I do this, and I'm just, for those of you who can't see, I'm just like moving my body around. It's rotation on a fixed femur. And I think so if I were to prioritize the big ones for golfers, I would say closed chain rotation drills to make sure that you can get adequate internal and external rotation with the foot on the ground. There's no point in trying to improve range of motion with your foot in the air into internal and external rotation, because even I, not a great golfer, whenever I hit the golf club, both of my feet stay on the ground. And, not by much because I'm not a good golfer, but even I know that they should probably both stay on the ground. So that's a big one. I think the second one would be direct core work. There's a lot of sports and rehabilitation, especially when we deal with sports that are maybe more prone or more sensitive to lower back issues. Basketball comes to mind. Golf is probably at the top of the list, actually. We get it stuck in our head that the strengthening we need to do is very remedial and very static, right? So a lot of times people are doing bird dogs and side planks and curl ups and these very geriatric type movements, or anti-movements, if you will, right? Limiting the amount of movement at the lumbar spine, which I think is the furthest thing from sport specific, especially when it comes to golf, because, golf is it's static overcome by dynamic. So you kind of have this moment of stiffness when you make contact with the ball that is preceded by a ton of aggressive rotation. And that's where you're going to need your core muscles to be, the most active. You never try to keep you're basically using your rib cage and your pelvis as a slingshot and moving one away from the other and creating a lot of eccentric potential as you wind up your backswing, and then moving through a lot of concentric acceleration as you move through your follow through. And I think training the core directly, like the way a bodybuilder would train it, with, crunches and side bends and
Like
and leg.
rollouts, like extension flexion stuff.
Yeah, flexion, extension, but dynamic, right? So moving from insertion to origin and all three planes, right? So doing side flexion things, so frontal plane movement, doing rotational things, right? Transverse plane movement, doing flexion extension, sagittal plane things like rollouts or med ball slams. I think that's where golfers leave, and athletes in general leave a lot to be desired, is that their preferred method of core training is way too static, where a lot of times in sports that it's our appendages that are static, our arms and our legs stiffen up while our trunk is very dynamic, right? Like I think of like a football player about to get tackled, stiff arming someone. The core needs to be able to be malleable, while this, the arm and the shoulder need to be very rigid, where a lot of times we see, progressions in exercise and strength and conditioning for sport around the core being the exact opposite principles, where it's like, we might have the arms moving around in a bird dog, and the shoulders are flexing and extending, and the hips are flexing and extending, while the neutral or the lumbar spine is maintained motionless. And that's the cue. It's like, well, that's not going to prepare anyone for anything. It's going to prepare you for the bird dog Olympics, but that's about it.
I like using bird dog.
Yeah, and hey, to a certain degree, it's all about preference. But when we dig into like the sport science of it and the applicability and the transferability into sport, there are, it's a completely different beast when you go from resisting your own body weight at no acceleration to trying to use that midsection to create the most amount of force possible. And that goes right back to our equation again of applied force greater than tissue tolerance.
So would something like, you said all different planes of motion. So would you say like a med ball throw, like where you're just like rotating sort of thing, like where you're accelerating, then catching it to decelerate, sort of something like that? Is that what
I would go? I would. So I think you get a lot of that in golf already. You get what I like about golf and I like about throwing sports in general is you get a true concentric phase. Because a lot of times concentrics are mediated by the fact that there's a point in a repetition in the gym where the muscle is shortened and then has to begin to lengthen, but there's no underloading phase. With golf, there's a massive underloading phase, right? Because you hit the ball and then you just need to slow down. Pitching, it's a very similar sensation. The ball has left your hand. Now you need to switch from gas to brake pedal, right? Very, very quickly. So in the gym, the idea that you need to experience an underloading phase, I think might be a little bit too like the thing that you're doing already. I'm literally talking about like follow a bodybuilder around the gym when they train their core and do the things they do, like rope crunches, single arm loaded side bends, some sort of twisting motion resisted. I mean, I'm a fan of like a half kneeling wood choppers low to high, right? That would be a good variability for a golfer that's going high to low a lot. And you'll see the asymmetry of like, on the side they follow through on, they're probably better going low to high because as the ball makes contact and they continue their follow through, that oblique sling on that side is used to being able to move through from low to high under the velocity or force created by the acceleration after the ball is swung. And then you'll see the exact opposite on the other side, right? If you wind up over here, over your right shoulder, and you take that same person and put them in right hip extension in a lunge and have them start low and then come high with a rope, they are going to fall on their face. They have no idea where they are, but you put them in the shape that they're used to, and then they're rock solid. And the goal is not to create symmetry, but to create variability, to have them be able to just start to generate torque again between the pelvis and the rib cage. And then that'll allow you to kind of keep it on the tracks.
Okay. Maybe we should start a golf class.
I'd be so bored. Please don't. I'll help write the program, but don't make me golf.
You'll be the face of it.
Oh my God. You want to sell? This does not go well at golf. This is not allowed in golf courses.
New age golfer,
Yeah, call Bryson DeChambeau.
Yeah.
I think he's got arms bigger than me, probably because they weren't drug testing during.
No,
COVID,
he lost some weight. He was going crazy there, trying to create all this speed, and I think he got to a point where he was creating so much speed and he wasn't controlling it. Like he was hitting it over the map, and he realized that when he got to a certain point, there was like a sweet spot, a certain ball speed that he got. He was like, okay, I can't really go past this ball speed because I can't control it.
Yeah, and then the drug testers started coming around again after COVID, and then he started getting small again. So
Well,
maybe that has something to do with, oh yeah, no, I got to slow down the ball speed. I can't control it. No, it's because WADA's coming around again, and they're coming.
well, that could be true. Um, what have you changed? I like this question. What have you changed your mind about? Let's say in the past 10 years, like one or
What
two
have I
things.
change my mind about? I'm pretty stubborn. No, I'm sure it's a long list. Um, I've shifted focuses, I think. I think a lot of the things that I believed in early in my career, I believed it off the backs of experience and what had worked for me. And I've been weight training since I was 15. And like the first day in the gym, I was like, this is what I'm going to do for the rest of my life. Like, I don't know how yet, but I was very like ahead of the learning curve early. So I had a lot of practical experience by the time I hit grad school. And but yeah, part of it is learning a lot more, part of it is experiencing a lot more. I would say a larger part of it is experience a lot more, but I think I've shifted focuses. I would say my focus now is far more on exercise programming and exercise selection than exercise execution. Where early in my career, I think I was very focused on the nuances of exercise execution, which I still like to, kind of nerd out and try different things and all that. But I would say that's something that's definitely a noticeable shift in my attention when I work with people. It's like, yeah, I could fix this, but is it something we need to fix? Is my fix just putting you in a similar position that's better constrained for your abilities that I don't need to worry about you thinking, right? I can actually just have you work. So that would be one that kind of jumps off the page. I probably do way less manual therapy now than I did, even with the clientele that I would say, especially with the clientele that I work with. And I maybe advise people to move away from that. I pretty much do as much manual therapy as my clients or patients or athletes like. And then I do the rest as just exercise and I think that is something from a rehab, whether you're a physical therapist or a chiropractor, I think it's like, when you start to see the long-term changes you can make in a very short window of time with well-prescribed exercises, and part why I shifted my focus towards exercise selection was when I started to delve into more prescriptive exercises that weren't just corrective and underloaded. I started to get way better results, and as a byproduct, now I do far less manual therapy that I have. There's still an analgesic effect to it that I will lean on, and I use my hands quite often, but not nearly as often as I had before. So those are two that jump off the page. I'm trying to actually answer your question. Is there something I've changed my mind?
Yeah, like it could even be nutrition, or it could be, it doesn't necessarily have to, you could think about it. We can come back to it.
Yeah, I mean, nutrition would probably be, that's tough. I think that I have a less biased opinion about nutrition. And I think I am more influenced by the research because it's not my formal training. So I have more of like, okay, yeah, my protein intake is way higher than it used to be. I think I was one who kind of bought into, not necessarily that protein was bad, but that you didn't need as much of it as people thought. And I had people around me who were very well experienced who were like, nah, you should probably eat more than like a gram per kilogram of body weight. And I've seen some really good results personally in pushing that paradigm. So that's something that I used to think like, oh, okay, like protein, sure, whatever, gram per kilogram, that seems fine. And now I'm over a gram per pound, which has been super, like a noticeable difference, very useful in my training and recovery. I'm gonna think about it because I do want to hopefully find something that I've like 180'd on, but I'm stubborn. I don't know. That'll be tough.
What are you weighing at right now?
I'm waking up around 271 in the morning.
Okay.
So,
and like I like routines. I'm a big routine guy. What's like it? I know. You're laughing. What's like your routine And like, do you have a morning or an evening routine? And also like your training splits right now?
Yeah, I'm laughing because I travel so much that it's very difficult
Yeah.
to keep a routine. I have milestones I want to hit. Like, I now in this phase of training, I'm up to 350 grams of protein a day.
Jesus.
Um, yeah, I mean, but at 270, it's about
Yeah.
1.2
I forgot that
grams
you weigh
per
270.
pound.
Yeah. I'm thinking
Yeah,
about myself. I'm 180. So
yeah. So it's but if I'm here in Toronto,
yeah,
up until
normal.
yeah, up at 4:30,
Mm.
I get breakfast together, which is usually I do like cream of rice, which works out to be like 40-50 grams of carbs, and I put 40-50 pounds away, put a microwave a cup of a half of berries in there, eat that, drive to the gym, train, come home, pound of bison, about 90 grams of carbs and rice. Uh,
So bison with rice.
Bison with rice, yeah. So that's good for with the rice, about 100 grams of protein per meal, about 80-90 grams of carbs, 40 grams of fat. I do 2 of those meals a day. I do 2 of the cream of rice meals a day, and I do a can or two of canned chicken, which are 50 grams of protein per. So that puts me right at 350. It's simple, man. Like I don't know. It's and then on travel days, it's like I have habits that I get into. I wouldn't say they're necessarily routines, but I've traveled so much that, if I'm traveling across time zones, I do something different than I'm traveling within time zones. Like
Oh
if I'm
yeah.
traveling within a time zone, I'll make sure I train beforehand if I can help it, unless I'm going to a place where I really like the gym, and then I'll train after just because I want to train at the gym. But if I travel across time zones, regardless, like my rules, regardless of when I land and what time it is and what time it is when I left, I have to train first thing. Supplementation wise, I find vitamin D helpful. Melatonin on deck. I usually have no trouble getting to sleep because I'm always so tired. But there's definitely like habits when I'm home and habits when I'm traveling. And then my habits at home will depend on my pending traveling schedule as well. Like it's a very fluid process, but I've somehow been able to, with I don't know, I think I crunched the numbers the other day. In the last 4 years, somewhere over I'm somewhere over 750,000 kilometers in the air since 2020, which probably
Wow.
puts me over 1 million in the last since 2017. So I've somehow been able to like keep doing the stuff I like to do, being able to manipulate the variables I want when I want. If I want to lean out, I know how to change those habits. If I want to gain weight, I know how to change those habits. But as far as routines, man, I'm the worst person to ask for
Yeah.
that.
Well, I'll tell you, it is not. I don't travel a lot, but I gotta imagine there's an adjustment in like, you talk about recovery, making sure that you get good sleep, and when you're traveling a lot, I bet that could be different time zones and trying to make that work is not easy. But
There was a point. There was
yeah,
a point early. It's like, I mean, I hate saying it's like everything, but if you do it enough, like last year, for example, I did 210,000 kilometers in the air, and I was on 86 flights, which average out to a flight every 4 days. And it's just the
mm,
jet lag becomes less apparent. My ability to just fall asleep and wake up when I have to it becomes easier. And there's just different things you prioritize, like hydration. When you start to understand a little bit around like cabin pressure and maximum velocities and all that, like there might be times strategically where I don't have carbohydrates for a few days leading into a long haul flight. Like I know that pressure is going to increase inflammation, and I know if I'm holding more water than I have to, like there's just little things you pick up along the way that really over time, when that becomes your life and career, it's becomes super useful to help just keep things on check. I keep things in check.
training split. If you let's
Yeah.
just I'm sure it's changed through the years, but let's just say right now, what would you say your training split is?
Yeah, so I run a push pull legs arms
Mm.
split. So I put an additional arm day, which looks in some ways like an additional push day, like it's a shoulder focus push. I have like a myriad of injuries to both shoulders, and I find being able to train arms with some reserve, because a lot of times arms, bicep, triceps, and delts will sort of get deprioritized in a push pull leg split. into later within a session, which kind of leaves limited resources as far as energy, especially when they're following such large movements. So for me, it's definitely been a staple of that, like push, pull, legs, arms. The arm day might be intermittent as like almost like an active rest day, and I might move that around. But definitely push, pull, legs is kind of the cornerstone, but arms is probably something I'm doing in a cyclical basis on, 4 or 5 day rotation.
Okay. So hitting it twice a week, you're doing that. Yeah.
Yeah, and you know what? I think part of it is, part of it's expediency, but I think for me, a large part of it is when exercise execution is at a high level and you're very confident in training to failure and you're very confident to train to failure with the exercises you've selected. That's big, right? Because failure has different definitions per person, per movement. So for me, it's like I know with the movements I have that I can really, unless they're strategically put in there for some sort of secondary benefit other than hypertrophy stimulus or strength or what have you, I have a concerted effort, which only leaves my sessions 45 minutes to an hour and 15 per day, but I get a more effective volume through frequency rather than through a single session, right? Because it's like, if you start handling heavier weights, and I'm not as strong as I once was, but on average, the weights that I'd be managing for multi-joint exercises are heavy. Your ability to keep turning those over set after set within a single session just tanks. A couple of heavy sets to failure on a compound lower body movement or something, like the rest of the session has a very abbreviated timeline. Right. The second I'm done my second working set of my second exercise, if that's the model I'm going with, I maybe have 35 minutes of gas left in the tank. And that's not necessarily a commentary on the gas tank as much as it is a commentary on the foot to the floor. Like there is a lot of torque, quite literally physically generated lifting heavier weight. So I think it's something where if you're a novice, like if someone is listening and there might be new to lifting weights, maybe full body splits 3 to 4 days a week. And then as you progress, going to something like an upper day and a lower day. And then as you progress again, then you can go into push pull legs. And I'm at a point where, push pull legs and an arms allows me to just kind of stoke the fire. I think like a bicycle wheel spinning after you've changed it. Like, yeah, early days, you're going to have to when you first start training, there's you can be in the gym for longer, but once that thing is spinning, you want to just tap, 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 tap. That's all it really takes to keep it spinning. So that's kind of my take on my training split right now. And I gotta say, for the last couple of years, that's been more or less the framework of it.
And your off day, so you typically take a couple of days off. And your off days are just complete off days, right? You're not doing anything. Are you doing
It's tough. Off days are usually travel days, which are not, and so off days and travel days are not rest days. And then it to me, there's a psychological component to my training that supersedes any sort of desired end result physiologically. So there'll be months where I train every single day because I just need to keep my head on straight, because I'm traveling, I'm home for a few days and I'm like, oh, okay, if I'm going to deadlift, I try and keep that, as far away from any long haul flights as I can. I've been lucky this year on long hauls, but later in the year, it's going to be an issue. But then it's a matter of okay, well, I flying to the West Coast, probably get better sleep if I land at 9 and if I go train than if I don't go train at all. So, what is the net benefit of me getting terrible sleep on this annoying 3-hour time swing or me training for the 13th day in a row? I'm like, honestly, probably better for me to get better sleep if I'm going to be out there for a handful of days. So I'll take the L on training 13 days in a row to get better sleep that night as a byproduct of training. So it's a lot of give and take. But yeah, rest days for me aren't usually rest days. They're usually off days. Every now and then I'll sit in a sauna or something, but the luxury of time is not afforded to me that often. So for me, it's usually, okay, I'm on a plane for 20 hours. Well, there goes the whole day. I'll train when I get back. In my brain, I still train the same day, but it's, that is not optimized. That is not optimized for physiology. That's optimized for psychology.
Question: best exercise for glutes. What would you say if you were going to?
If I had one,
Yeah.
either something loaded or something lengthened. It's kind of a good rule of thumb if we're trying to think about, if I could do one exercise forever for a particular muscle group. I would have to say
Deadlifts.
that's something loaded. Yeah, it's something loaded for sure. That would do the trick. Yeah, I mean, either a hinge, a squat, or a single leg movement. I think I would probably tend towards a single leg movement because it's going to bring with it some ancillary attributes. You get plenty of hypertrophy stimulus. You get good length of the muscle, but you'll also get some movement variability that could potentially allow you to load that more long term. So, a contralateral, so a dumbbell in the opposite hand of the foot that's forward, some sort of step up movement that, has a dumbbell that's strapped to the opposite hand of the hip of the foot that's on the bench. And that'll allow you, to create some of that good eccentric internal rotation of the glute, get some good frontal plane movement of the pelvis, force you to create, a fairly active foot. So I think that is, plus being a really good driver of hypertrophy. I think that would probably be something where most people are going to suck at it at the beginning. Most people are going to it's going to improve their coordination. It's going to improve their mobility. It's going to improve their stability, but it'll also improve, it'll improve what we're looking for. It'll improve, muscle cross-sectional area of the glutes. So I think that would, if I
like
would put on the spot,
like a
step up. You can either do it in a Smith machine, or you can do it with a dumbbell in one hand, stabilizing yourself on another hand, or you can do it with a cable. But I would say step ups are pretty hard to beat, in my opinion.
Do you believe in stretching the hamstrings? Because since they're a long muscle.
Yeah. It's always a psychology, physiology thing. Like, my belief in stretching them, personally, no, I don't suffer from tight hamstrings because I like to think at least I operate in a position where the result of my hypothesis is as true as I need it to be, which means it's a really sensitive way of me saying, I think I know why hamstrings get tight, and mine are tight because I don't do the things that cause most people's hamstrings get tight. So hamstring tightness has more to do with the position of the pelvis than any sort of transient shortening or lengthening or whatever the common adage is. So stretching the hamstrings is going to do nothing to improve the awareness of the position of the pelvis. And if we can do that, if we can stabilize the pelvis better, more effectively against more force, a lot of times people are no longer inhibited by that sensation. Now, most people, who might be listening to this and thinking, well, why are my hamstrings tight? A lot of it has to do with the fact that they're technically just falling over all the time, right? And the muscle.
I was just going to say, sorry to interrupt you. Is it mainly, would it be their lateral hamstring that is typically tight and that you maybe can release, or like thoughts around that?
Okay. So you're not, so no, it's a really pointed question and a really good question at that. So there's your lateral hamstring. So your biceps femoris, the two heads, they are the dominant hip extender of the hamstring group. And they also carry with it this property of lateral rotation of the tibia. So they can point the toes outward, or are shortened as a byproduct of the toes being pointed outward. And the difference in the verbiage there is important. And those two attributes usually lead to those hamstrings being tighter than the medial semimembranosus, semitendinosus. But it's more to do with the fact that if you take someone who might be relatively deconditioned, right? You take a person who is not that strong, maybe hasn't been to the gym, maybe, is a bit overweight, their body and the autonomic nervous system is organizing their skeleton in a way to constantly be stopping them from falling over, right? So they are, as Kyle Baxter would say, weaker than the forces of gravity acting on them. And what does a skeleton do when it's starting to decelerate? It externally rotates. Everything opens up. It's a brake, right? So, pronation and internal rotation is a gas pedal. So when we're dealing with someone who's reacting to their center of mass being outside of their base of support in front of them due to the relative deconditioning and the fact that they carry a little bit more excess body weight, the nervous system puts the skeleton in a place that is a massive skeletal brake pedal, which means the feet are off to the side, the hips are externally rotated, the pelvis is dumped forward, right? The shoulder blades might be pinned back and the shoulders are internally rotated as a byproduct of the scapula is retracting or externally rotated. So when we see that, yes, it is the lateral hamstring, but without creating an ability to internally rotate, which is force production, without building strength, their nervous system is going to choose to fall into its structure over and over and over again. So we can release the lateral hamstring, it can feel good, but if the pelvis goes back into the same position and it dumps forward and pulls up the ischial tuberosity, which is the origin of the lateral hamstring, and as it pulls up on that, it's going to use the hamstring more as a hip extender than the glute. And then if the skeleton is deciding that the feet need to give us a broader base of support as we walk, the tibia is going to laterally rotate. And then that same biceps femoris that's going to be used more in extending the hip as we disadvantage the glute, as our pelvis jumps into anterior pelvic tilt and our lumbar spine then goes into excessive hyperlordosis or hyperlordosis, excessive lordosis. Then all of a sudden we have an overworked lateral hamstring at the hip and we have a pre-shortened lateral hamstring at the tibia. We have that lateral rotation. We have an anterior tilt. We get overuse of extension at the hip from the hamstring rather than the glute or the adductor. And then you get this thing where, oh, it feels good when I stretch my hamstrings. It's like, yeah, maybe transiently to get you into these better positions, we do that. But once we've kind of, moved that first tumbler in the barrel to really unlock that mechanism, we need to be able to better control the center of mass. And a lot of times that's going to be just getting stronger and better position.
Well said. So, okay. That was good. I will say some of the stuff that I'm learning as far as like to be applied is interesting. Like, for example, like a prerequisite for a deadlift, you would never think someone would say, well, you should do a body weight pull-up. But that's something that you talked about. You've talked about that before. Is that something that you align yourself with?
Yeah, I mean, it's a good safeguard.
Yeah.
Right? Like it's like deadlifting it's funny because I remember I forget who it was. Maybe it was Robert O'Bears on the Joe Rogan show. And he was a competitive strongman, or he was a competitive strongman athlete. And they were discussing deadlifts and they were discussing the potential like dangers associated with them. And it is in the gym, it's going to be the exercise that has the greatest amount of shear force on a lumbar spine. And the problem that a lot of people don't consider how to interpret the resting state of someone's nervous system, because it's quite an abstract thought to think. But if you're dealing with someone who is overweight, who is relatively deconditioned, and I'm thinking of a return on the investment of my time from an exercise perspective, I don't know if taking someone who's standing up exhibits the attributes of someone who's falling over. I don't know how much benefit I'm going to get of taking that person and then tipping them over. Right. So, and there could be a point where, and we see this all the time, like we see less than favorable body compositions at the pinnacle of strength sports, right? No one has abs. No one who squats over 1,000 pounds has abs visible, right? It's just not how it works. Right. You get a couple 900-pound guys, some guys that are close, that are relatively lean, but like when you're talking the strongest guys in the world, their center of mass is truly within their base support. They're very upright squatters and they have a very stable platform to do it off. But you get those same guys to bend over and do a deadlift. You have guys who are pulling 700 pounds, guys that I can out deadlift, that are squatting over 1,000, because it's the same. And I'm going to use the word very deliberately here. It's the same physics that makes them good squatters, that makes them bad deadlifters. So, for me, it's like if you train general population clients and your clients don't absolutely want to deadlift all the time, and it's like a milestone that they have to deadlift a particular weight, and you have this person on a year contract and you want to just get them the best results possible in losing weight and building muscle in that first year, maybe in the first 3 years, maybe in the first 5 years, unless they come in and say, I saw this person deadlifting and I really want to deadlift, I really don't see if I'm coaching someone 3 to 4 times a week or they're training 3 to 4 times a week. I don't see where the value is necessarily in most cases to putting an exercise like that in there. Because it's just going to run into too many technical bottlenecks. It's like, I don't need them to think. I need them to work. I need them to work for like 3 or 4 years. And then once you know it, after 3 or 4 years, hey, look, there's that body weight pull up that we were after. And now we can control our center of mass. Now our lats and our spine can interact in a meaningful way. And then sure, yeah, you want to deadlift? Go deadlift. Great. It's just, people are very dogmatic. There was like a point 10, 15 years ago where like every article was the king of all movements, the jack of all movements. Like, what is this royal family of movements? Who is this appointed monarchy? This, this, and it's like this, it's all bullshit. Like, it's all just this, like, the front squats are the king of, it's like, no, none
Front
of it
squats?
is. It's like none of it, none of that stuff is true. And it's very hard to break away from like the blood and guts type of raw beat your chest type training, which like, hey, yeah, I love that stuff. And I deadlift. It's my major compound movement in my training cycle, but it's like, I do a lot of stuff that other people shouldn't do. Right. So it's, I think it's something where it's a good axiom to follow. And I think if people think about it logically and are trying to maximize the results of their clients, they find very quickly that a movement like that goes away and gets put on the back burner until which time where they've made a bunch of incremental progress elsewhere. And then usually it coincides with like, wow, I got my client down 40 pounds and, their measurements are better where they should be and down where they also should be. And they're pretty lean now. I think I need a really loadable exercise. Like, great, deadlift is there, but I bet you the pull-up's going to be there too.
Well, and one thing you talk about too is sort of this progressive approach where, like for squats, like instead of going right to like a low bar squat or a high bar squat, you can actually start with like a counterbalance squat and then work your way to the goblet and then perhaps the front squat. And then, so like, I like that progressive approach where if they can't do the first thing, why would you have them do back squats if they can't do a counterbalance squat?
Yeah. I mean, I my adage or axiom for that is, you always want to progress the movement, not progress the load, right? Or you always want to regress the pattern rather than regressing the load. So, for the most part, most people who walk into a gym recreationally, and even up until you've reached the echelons of advanced lifters, the difference in loading particular tissues is trivial, but the amount that you load the system is meaningful. So it's like the difference between quad versus glute hypertrophy stimulus in a session where you decide to go from a front squat to a goblet squat, or the amount of quad stimulus that is different between going from a front squat to a goblet squat. Yeah, you're going to get a little bit more knee travel, but you're dealing with someone who maybe has recovery constraints. Like if I have a client who's traveling, 2 days, they got to fly to Perth, Australia. And in the program, the day before I have front squats, I'm just going to have them do heels elevated goblet squats, because the constraint now is like, if that person can hold 130 pounds, that's like the greatest goblet squat I've ever heard of. This person would be front squatting 225 or 275. And then I'm going to go stick them on a Qantas flight from SFO to Perth, and it's going to be 17 and a half hours. It's like, well, what I didn't tell them to do was go front squat light. I didn't regress the load. I did, but I regressed the pattern, which as a proxy of the novel pattern, reduced the overall load, reduce the amount of fatigue debt that we would need to repay. And then within the hypothesized constraints of recoverability of a 20-hour flight to Perth, it's actually longer than that, at least from where we're at. But now I'm more on track than I would have been if I just decided to check the box that day and hit my 3x5 at 275 front squat.
This is great. A couple more questions, then we'll close it. I just lost my train of thought. No, I didn't. All right. So this is a question I ask all my guests. If you were going to give one tip to someone who's maybe gotten a lot of shape and they're trying to get their body back to what it once was 10, 15 years ago, what one tip would you give them?
Do stuff you enjoy. Number one, across the board, whether if it's someone who's an avid lifter of weights, or you just have to do the stuff you like, because that's going to be the stuff you do. That's really, I think that is the unspoken truth about discipline, is that people who do the things that other people find difficult, these people have just found enjoyment in. And that is, and so it's not, and I don't want to add to the noise of like discipline versus motivation, because I think it's such a silly way to people just voice their opinion about something to create content, and it's nauseating, and I don't care for it. But there are things that people deem difficult, like, Jocko Willink comes to mind, as he's this prominent figure in whatever digital space this is. And it's like, oh, he wakes up early and trains. It's like, he enjoys that, right? And you can listen, and I don't know him personally, and I don't want to put words on his mouth. And there are days where he could say, and I don't know if this is true, he might say that he doesn't enjoy it, but he doesn't anyways. But he does enjoy it. Like, there's a thing where people go, and I don't know if there's a handful of people who are very like raw figures in the industry, and they're hyper successful and super net benefit. And I want to get all those disclaimers out of the way, because I think these people are unbelievably useful for motivating society to get stuff done. I think of like a Goggins-esque character, and it's like, I'm not going to put his YouTube videos on, and because I don't need to be coerced into finding enjoyment of things I don't like. I know how to find the intersection of useful for me and enjoying. Now, if he can be the thing that catalyzes someone into realizing there's enjoyment in something, that fucking rights, man. Like, I have no bone to pick with any of these guys. I think they're doing great work. But I think what people need to realize, if they are ever, maybe a little bit mystified by people like this, and they don't find enjoyment in the things that they are, advocating and doing, and enjoy themselves, that these people are not highly motivated or highly disciplined people. Mm-hmm. They are simply doing it because they enjoy it. And we can sit here and be like, no, he even says that's a lot of every day before he puts his shoes on and goes for a run, he says how much he hates it. Right. But he still enjoys it. And whether it's the social credit that comes from us talking about him doing the thing and telling that story, that experience of closing that loop and our involvement in it is the thing that he enjoys. He enjoys being a public speaker. He enjoys being an author. He enjoys so whatever he's doing is an agent of his enjoyment, as a part of the corpus. He hasn't killed himself. He has not taken a gun to his brainstem and blown his brains out. So there is a net enjoyment in that. And I think it's very difficult for people who are trying to get back into it to really allow themselves to do stuff they enjoy, which is, and I don't think it's of any fault of anyone. I don't think it's Goggins' fault. I don't think it's Jocko's fault, but I just think it needs to be understood that when you're watching these aspirational characters, what you're really watching, and it's hard to understand because of the grit and the callous and the militant background. It's hard to understand that what they are doing is enjoying themselves, right? The net benefit of Jocko's empire, his podcast, all of that, his little Timex watch that he puts up after his kettlebell, that is part of enjoyment. And when people might not be cut from that Green Beret, Marine, Army cloth, Navy SEAL cloth, I think they get down on themselves because they're missing the point. Because the point is so thickly veiled behind this, you got to be you bitch, like running on the side of the road, that it's like, it is about enjoyment. And it's like, I could very easily just said, oh, enjoyment, do stuff you like, blah, blah, blah. But it's like, I think it's actually, it's much deeper a problem than we give it credit for. Because if it wasn't a problem, it wouldn't be a problem. Like, the reason that your question is such a important question, is because it doesn't have a really good answer. And what we see it to be a really good answer is it's there. It's the essence of the answer is there. It's right in front of us with every single person that we aspire to, that is an aspirational character in health and fitness, that does hard things. But what they've done, the only thing that they've done that's unique is they've made it enjoyable in some way, shape, or form. So that's my advice. And that's my diatribe on it. And I think there's something to that.
Great way to wrap it up, Jordan.
That's a good one. Yeah. But don't ask another question, because I'm just going to yell some more. He's clearly like, I'm that old man yells at clouds rev now.
Well, we can do a part 2.
Here for it. Always.
I'd love to. Because there's more I do want to talk about. Best place for people to find you, Jordan?
Yeah. Instagram at @the_muscle_doc, or shoot me an email, jordan@themuscledoc.com.
Yeah. And if you're looking for a cool certification, there's what Prescript 1, 2, is there a 3?
Yeah. Level 3 is we do hold that. That's a 6-day intensive down in Florida where you come with me to train off-season NFL players prepping for the next season. Yeah. That's really cool. It's it's like Mike Tyson always said, everyone's got a plan until you get punched in the face. So it's like kind of that, but on the coaching side.
That's cool. I like that. Was wondering if there was a live aspect, so that's cool.
Yeah.
Awesome. Well, Jordan, I appreciate it. You probably got to catch a flight, so thanks for coming on the podcast.
Of course, man. Thanks so much.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there, and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again, and have a great day.